And so some of the first studies of very high dose resveratrol were done in mice, and I won't go into this in detail, but essentially if you give a mouse, the red line, a really bad diet, and this is 60% of calories from fat, well above the Mediterranean diet, had no olive oil, their survival rates go down very quickly over the first year and a half. If you give them a standard diet, it is the black bar, this is their mortality. And if you give them, the mice, the really bad diet, but give them a very high dose resveratrol pill, it looks like they have the same survival as the mice on the standard chow. And some mechanisms have been examined with this effect, but in fact, to get this high of a dose, you'd have to drink about 10 bottles of wine a day. That is beyond moderation. So really trying to compare this to human data is really beyond extrapolation. It helps us think about mechanisms, but it's really probably not a good way to draw a parallel to human data. So our friends in the room, and I know I met Gemma last night, who works with Ramon and Rosa, has done a lot of work on the effects of red wine polyphenols, has looked at this in a really well-done study here in Spain. And there now have been many studies, several studies like this, where the alcohol was taken out of the beverage. So you could look at the effects of alcohol separately from other components in the beverage. And I won't steal their thunder because they're much better at telling this than I am, but each one of these represents a separate group that were given alcohol in different orders. This is red wine, this is red wine without the alcohol, and this is gin, and they were each given them in separate combinations to look at the effects of the alcohol from the gin, the red wine where the alcohol is mixed with the polyphenols, or just the red wine which has the red wine without alcohol. And what they do see, I think, is interesting, and I do think it really stands for us to study this in longer periods of time. This was 4 weeks in each arm. But what they found is that if you have red wine, the benefits are clear for lowering insulin resistance, and increasing HDL. So this probably explains some of the beneficial effects of alcohol on diabetes and some of the beneficial effects of alcohol on heart disease. What they found is that if you give people just the alcohol, that the benefits for insulin are not quite as strong, even though the benefits for HDL are equally as strong. So it may be that red wine is good, and maybe even a little bit better than gin or other forms of alcohol. Obviously, this was a relatively short-term study, so we don't know what happens long-term. Most of the epidemiological studies that I'll show you find equal benefit whether the population drinks red wine, white wine, beer, or spirits, and that may be how people usually drink it, and I'll show you some examples of that. This is the famous Serge Renaud, who we were just talking about, who passed away a few years ago, who's really sort of the father of the French paradox, and I'm sure our next speaker will speak to that. And he studied this in a large cohort of France and did find that red wine is a little bit better than beer. Although I think back in the 70s and 80s when this was studied, more people drank red wine frequently than drank beer. So this may be a better documentation of drinking wine almost every day, speaking to the frequency of intake being more important than the amount. This is what happens if you study beer in Germany in the 70s and 80s. Most people drank beer, and you see the same reduction due to beer intake. And this is studies from Japan in the 80s and 90s, where most of the consumption is distilled spirits, and here again you see the same benefit. So maybe the next step is to do a double-blind trial of alcohol use. Notice both the investigator and the participant are double-blind. Well, we're working on this. We have now pilot funding from the US government to plan a long-term randomized clinical trial of alcohol that we're hoping to work with several of our colleagues in Spain to try to do this in a long-term fashion to look at primary endpoints like cardiovascular disease and diabetes. Obviously, the participant probably will not be blinded to whether they're getting alcohol or not, although hopefully the investigator will stay blinded. So again, I think that ultimately we know the ethanol effects that are in red wine, beer, and spirits act through all of these mechanisms, and thus, therefore, probably all drinks will be beneficial. So why not tell everyone to drink? And that's really the question that comes up. I showed you the guidelines that says for those who do drink, they should do so in moderation. But should we tell everybody to drink? Well, in the United States, about 70% of men and 55% of women drink. But those who don't drink usually don't drink for a reason. It's for religious reasons, or because they used to have a drinking problem, or because their father or mother had a drinking problem. So I don't think those people should be told to drink. And I don't know what percent of people in Spain drink. I'm sure it's a little bit higher. But those who don't drink probably should not be told to drink because they don't drink for a reason. So it becomes a real juggling act. And I show this picture because in this picture, it was actually a story on alcohol in the Mediterranean diet, and I was juggling an apple, an orange, and a banana. You don't see the banana in the picture because the magazine, the Wine Spectator, without telling me, superimposed a bottle of 1990 Chateau Latour, which is now a 3,000 euro bottle of wine, superimposed it over the banana and forgot to tell me before the magazine came out. But it's really a nice picture, so I decided not to get upset about it. But it is a juggling act because there are people who are at risk from drinking too much alcohol. And so I don't think we should tell everybody to drink alcohol, and it should be just consumed in moderation by those who choose to drink. Here's another way of looking at it. This is time. This is our prestige. This is our own thoughts of our career, and our hope is that we would follow this blue line, that as time got on, we would become more important and we would gain great prestige in our careers. This is more reality. We have our ups and downs in our career, and some people use alcohol to make up for the fact that they wish they had done much better in their life. This is not a good reason to drink alcohol. Once in a while, it's okay to calm your nerves, but this is another reason with telling everybody to drink moderately, is that this kind of drinking can unfortunately lead to problem drinking, where then ultimately we would want people to stop drinking altogether. So why shouldn't you drink? Well, this is or who shouldn't drink, actually. This is an unpublished paper that I'm working on with a postdoc of mine, and we separated the N. Haynes study, which is a nationally represented a study of the U.S. population, into the white population and the black population in the United States. And we have never drinkers as our reference group, and this is the rates of all-cause mortality. And among the whites, you can see that those who drink infrequently, and this is those who drink frequently in moderation, this is where they have lower rates of all-cause mortality. Among the blacks in our population, we don't see that those who drink frequently and drink in moderation have the exact same rates of mortality. And that may be due to genetic differences in metabolism of alcohol. It may be differences in background diet. There may be a number of differences that explain this. So I still don't think we know all the answers when it comes to differences in how alcohol interacts with our diet and with our genetic background to impact the typical U-shaped or J-shaped association that we find for alcohol. So other people who shouldn't drink, and many of you are familiar with this, are individuals who can't restrict their drinking to moderate levels, children and adolescents, individuals taking medications, and those who already have medical conditions which are detrimental if alcohol is consumed. Also, in general, we tell women who are pregnant not to drink, although we say once in a while it's okay to calm the nerves. And of course, individuals who are planning to drive or operate machinery should not drink. Anything that requires good judgment should not drink in moderation. And part of that comes from the fact that there is now lots of good epidemiology on the impacts of binge drinking. And binge drinking really is not part of the Mediterranean diet. And I know that there are many people still in France and Spain and Italy who do binge drink, but the traditional Mediterranean diet has that glass of red wine at the side of the plate where alcohol is consumed as 1 to 2 drinks with the meal. And part of that is that in about half of drowning victims that's found alcohol is in the bloodstream. Somewhere between half to 3/4 of individuals who die in fires, they find significant amounts of blood alcohol. And also, obviously, unintentional falls are a consequence of heavy alcohol consumption. I didn't talk much about stroke today because the association between alcohol and ischemic stroke is similar to what you see for alcohol and heart disease, maybe not quite as strong. But for hemorrhagic stroke, this is one of the first studies to document the positive association between alcohol and hemorrhagic stroke. And this actually was done looking at people after they came into the ER and subsequently following them. after they had had a hemorrhagic stroke, and those who had excessive number of binge drinks, which is 5 drinks in any one setting for a man and 4 drinks in any one setting for a woman, and those that had more than 1 binge drinking episode a week had 4 times the risk of a hemorrhagic stroke compared to those that were non-drinkers or drank in moderation. So ultimately, the question came up, Dr. Gonzalez brought it up last session on alcohol and breast cancer. And this was the first pooling study of 8 cohorts from 3 different countries, representing 300,000 women. Subsequent to this, there's been probably 15 or 20 studies, maybe more, that have documented a very clear positive association between alcohol and breast cancer. It's weaker than the benefits we see for alcohol and heart disease, but nonetheless, there's about a 10% increase in risk of breast cancer per drink per day for women. And the question is, what is the mechanism? Some of it could be hormones, but we do know that alcohol interferes with many micronutrients in the bloodstream, and folate is probably the one that's been best studied. And so our interest was to look at what if someone is on the Mediterranean diet or has a diet that's high in fruits and vegetables, and therefore has at least 600 micrograms per day of folate in their diet, versus those that have much lower levels of folate. This is from the Nurses' Health Study. And what you can see, if you have a low folate diet, the association between alcohol and breast cancer is still about 30% for those who drink 2 drinks a day. But as your folate levels get higher, there's actually no risk of between alcohol and breast cancer if you have a good diet. So I think it's important not to be thinking of alcohol alone when studying the association between alcohol and chronic disease, because it is so important in how it interacts with the diet. So hopefully going forward, especially in the PREDIMED study and looking at the Mediterranean diet, that we continue to look at the synergy between alcohol consumption and our diet and how it impacts chronic disease. So now there have been many studies of not just heart disease and breast cancer, but just what all-cause mortality, people dying of accidents, suicides, heart disease, breast cancer, colon cancer, all the things that we've discussed. And this was really the first large-scale study to look at alcohol and all-cause mortality. This was 500,000 people studied for 9 years in the United States. And for men, what you saw is the bottom of the curve was somewhere between 1 and 2 drinks a day. Now, this has just been published in the EPIC study also. I'll show the women. The women, you see the same benefit, although the curve is not quite as steep. But again, because more women die of heart disease than die of breast cancer or colon cancer, not surprisingly, you also see this inverse association where women who live the longest were women who drink about 1 drink a day. So the EPIC study just published this recently, and they also see very similar shaped associations. These are all the different causes. This looks like the Mediterranean diet with sort of with the spaghetti and the vegetables mixed together, but what you see is there is sort of the classic U-shaped association, and what they documented in this particular analysis is that former drinkers and former past heavy drinkers really had the highest risk. They were way up here, but really light and moderate drinkers at 1 to 2 drinks a day for both men and women had the highest longevity and the lower overall risk of mortality. So both in the large European studies and in the United States studies, you see this benefit at light to moderate consumption. So the take-home messages, I think, the alcohol content of the main beverage types are similar, whether it be red wine, white wine, beer, or spirits. And it does seem that alcohol lowers risk of diabetes and heart disease, and from the large epidemiological studies that the benefit is pretty similar, whether it be from beer, wine, or spirits. Red wine may be a bit better, but the benefits overall seem to be pretty similar. And I think it's important that it probably hasn't been emphasized enough that if you do drink, you should eat a good diet. Now, what we've heard during the last 2 days is you should eat a good diet anyways, and what I'm suggesting that you should eat a good diet and alcohol should be part of that. Clearly, we should avoid binge drinking. The benefits for alcohol probably are stronger for when you have small amounts frequently, as opposed to trying to have all your alcohol on the weekends or having it on just a few days a week. The benefits that we've seen are not substantially different by beverage choice, although I still think there's great work to be done in this field. And of course, people who drink moderately live longer and I would say happier lives. So I will stop there, and thank you very much for your time, and I would point you to Nutrition Source for more information.